Hello friends. So today's topic is ovulation impotency. Sounds strange, isn't it? And unusual because ovulation takes place in women whereas impotency or erectile dysfunction belongs to men. So what is the connection? Where during ovulation period of women, men get erectile dysfunction in a couple where they are trying for conceiving. Now, there is no direct medical correlation or connection, but it is more of psychological and situational. What typically happens, and we get hundreds of couple like this. After 3 to 5 years of marriage, now they are desperate to have child. They have been avoiding this due to fast-paced modern life, busy with career, busy with fulfilling home loans, competitive world around, stress of daily life, trying to adjust with new environment at in-laws place or in a new city. So there are many reasons that couple tend to avoid conceiving in initial at least 3 years. And when then the pressure starts mounting, like peer pressure, the younger brother or sister has the couple has conceived, friends have conceived, colleagues in office have conceived and have child, friend, and the parents generally tend to ask that when are you giving good news, now have child, don't delay. And also the age is catching up, age goes beyond 30, 31, 32, and you come across literature as you get conceived at a later age, chances of difficult pregnancy or problem with the baby's health are higher. So now there is a pressure mounting on the couple. Already other pressures are going on, the work pressure, the financial pressure, and on top of it now they want to conceive. So when they want to conceive, generally the first step that the couple take is, one, they approach family doctor or a gynecologist, or they Google out that what is the fertile period, when does a woman ovulate, and accordingly they start counting the days and they find out the dates when the ovulation period or fertile period is there, and then they decide to do intercourse in those days or around those days. Now one thing is very simple and basic: the best of sex happens when you are totally spontaneous and sensuous, not when you plan it. A good sex doesn't happen by planning, it has to happen naturally. The feelings has to be there, the attraction has to be there, the energy has to be there, the mood has to be there, and then the flow has to take place in terms of your sexual chemistry. Then the good arousal takes place, good erection in man, good lubrication in woman, good pleasure, and ultimately they reach orgasm or climax, and man ejaculates inside the partner. And then of course chances of conceiving depend on fertility factor, whether woman is ovulating or no, whether man's semen analysis report is normal or no. But essentially couple needs to have a proper sex life so that there is an insemination happening inside the woman during this ovulation period. Now the moment they start planning that okay, we have to do today or we will do it today, fine, but when the night comes, it's something which is very mechanical. See, you can't will an erection. A man cannot will an erection that, okay, I want erection, get upright. No, it doesn't happen. When you don't want, it happens. So it all goes to your spontaneity, and how you feel sexually aroused naturally. So when they plan it, often it doesn't happen. And then the pressure starts mounting from within. Oh, what has happened to me? Is there something wrong with my erection? Will I be able to do next time? Okay, that today is the day of ovulation. If not today, when? We'll lose one more month of chances of conceiving. And then all the background pressure, the peer pressure, the parental pressure, the inner pressure to conceive, everything starts adding up. And then what adds up is also the performance anxiety and pressure. I didn't get erection last time. Will I get it now? Will I get it next time? We are losing on time. The age is catching up. So then what happens, it becomes not just mechanical, it also becomes a challenge, a huge challenge and a task. Sex should not be a task, okay? It should be something, a beautiful journey of intimacy, right? Of enjoying together. So When things become a task and a challenge, it further leads to more anxiety and pressure, which further leads to decline in erection. So erection which has to come also doesn't come, or erection which comes doesn't sustain. See, what's on your mind is on your body, provided medically you are normal. If medically you are normal, how would you know medically you are normal in terms of erection? Other days when you are not planning sex, you have good erection. You are able to do proper intercourse. Morning erection is good. If you masturbate, it is good. These are physiological parameters which we look for as a doctor in patients that he is otherwise normal. Also, we do blood tests, so we rule out any possible early underlying factors, hormonal or medical, which might be leading to erectile dysfunction. We rule out even lifestyle problems, including habits and addictions like smoking, alcohol, etc. So, after ruling out medical factors, addiction, and habits factors, then we conclude that yes, this is purely psychological and situational, and there is a way to come out. But just by saying it doesn't happen, because it becomes a subconscious pattern in the man. He becomes too conscious and nervous and too much under pressure, because that pressure to conceive and pressure to get erection both make it very complicated. So there is a way that we have devised, a beautiful way, where hundreds of couples, maybe thousands of couples have been benefited. This is an integrated sexology pioneered by us, wherein we have multidisciplinary approach, where we do individual counseling, couple therapy based on American sexologist Masters and Johnson, homeopathic remedies, stress management, and certain techniques. So couple very smoothly comes out of all the anxiety, pressure, tension, and sex really becomes once again joyful and spontaneous and sensuous, and they get natural arousal. Men gets natural erection. They are able to have proper intercourse, and they are able to have proper insemination inside the partner, and hence chances of fertilization are maximum and natural. So, young couple, please don't be anxious or nervous if you are facing this problem of ovulation impotency in inverted comma. If you are experiencing this problem, there is a way out, and there is a very smoothly we bring couple out of this. And if their fertility factors are normal, in no time, I mean in just couple of months, with proper natural intercourse, they are able to conceive as well. All the best. God bless you.